Hi everyone, this is Neel Raithatha, consultant audiologist and director of ClipX. I've got a couple of confessions to start off with. Now, the thumbnail image isn't of this patient's left ear, which is what I'm treating on screen now. It's actually of their right ear, but I'm going to upload that video hopefully tomorrow. And it illustrates just how shocking and severe this earwax impaction is, because despite the size of that plug in the thumbnail, it was their left ear that was the worst ear. The second confession is that you're joining the video probably about a quarter of the way in, and I purposely did that because the more lateral wax, there was quite a few hairs in the way, and I decided to trim that out of the video completely, edit that out, because this is the nitty gritty, and this is what I think you guys want to see. Also means the video will be extremely long, and it takes a long time to kind of edit these videos. So it's the first time I've actually done that, but hopefully you guys will forgive me for both of those confessions. Now, this patient attended in between Christmas and New Year's, and before that they attended a couple of years ago, and back then it was a really severe impaction. So I did kind of advise this patient to come on a yearly basis, but when you suffer from wax, and once your wax is removed and then you don't have any symptoms, it kind of slips your mind. I can appreciate that. Now, this wax, how do I describe it? It's really impacted, and it has almost a chewing gum consistency. So along with the clay type of earwax that you always hear me complaining about, this consistency of the wax is probably a close second, if not a joint first, in terms of the wax I least enjoy removing. And there were a couple of moments during the procedure where, I thought I've managed to get all the wax out, and to my horror, when I re-entered, there was just more wax. Now, this plug of chewing gum type of wax is quite deep. It's in the inner third of the ear canal, a region that we call the pars interna. Now, for those of you who are new to the channel, I'll give you a very brief anatomy lesson on the ear canal itself. So the ear canal, first of all, it's not a straight cylindrical tube. It's more oval shaped. The height is greater than the width, and it's approximately 26 millimeters long from the entrance to the eardrum in an adult. There's of course variation, not only between individuals, but genders, between adults and children, and also between right and left ears. The outer third of the ear canal is made up of cartilage, and the skin that lines the cartilage is also quite thick in comparison to the skin that lines the bony part of the ear canal, which is the inner 2/3. So the skin that lines the cartilage portion of the ear canal, which, given its cartilage, it's more malleable and flexible, as opposed to the bony part of the ear canal, which is rigid, is 1 millimeter in thickness, and it has 3 layers. You have the epidermis layer, which is the most superficial layer of the skin, and it contains dead skin cells, what we call corneocytes. It also contains the dermis layer. Now, the dermis layer is the middle layer of the skin, and it houses the hair follicles, blood vessels, the nerves, and there's also collagen and elastin that gives the skin its shape and smoothness, if you like. And then also you have the hypodermis or subcutaneous layer of skin, which is the deepest layer of skin, and that's predominantly made up of adipose tissue, which is essentially fatty tissue. So that skin is quite thick, and it acts like a buffer, and because it's cartilage underneath, you can apply a bit of pressure on the outer third. The inner 2/3, however, it's just skin on bone, and when I say skin, it's only that superficial layer of skin, that epidermis layer, and that's the thickness of that is about 0.1 millimeters in thickness. So you can compare the bony part of the ear canal, the inner 2/3, in terms of if someone makes contact with the bony part of the ear canal, and I'm saying this from experience because I've experienced pain, trauma to my ear canal before in the bony part, if you bump your shin bone against the side of a door or a chair, for example, it's a very sharp, acute pain. So whenever we're working this deep in the ear, particularly with manual instruments, which is what I'm having to resort to, we've got to be really, really careful. The last thing I want to do is impart any pain or discomfort to this patient. Now, just a moment ago, I got the hook in and I extracted it, and I thought that would be all. I thought it would come out all in a big plug, but it went back in, and there's still loads of wax here. We are making some headway, but I think it's another 9 or so minutes, and I'm just throwing the kitchen sink at this, not in terms of how aggressive I'm doing it, in terms of using all the instruments that we have to help us remove wax. The only one I probably didn't use a lot, but I did use it a bit later, is the forceps, and that's because it's very difficult to use forceps with a plug of wax that has a flat surface, so there's nothing for me to grab onto, and when it's compressed and impacted against the canal wall, because for you to use forceps, you need to grab onto something. In addition, with this type of consistency of wax, like a chewing gum, the forceps will most probably sort of extract the plug, it will stretch it like chewing gum, or just pull it. So I've just put loads of drops in this ear. I'm using drops on several occasions, and this is where it's lodged. So as we approach the eardrum, the ear canal narrows and then it widens again, and this the tail end of this plug is impacted beyond that narrowing, where the ear canal then balloons and protrudes out again. So we're having to bring a larger piece of wax through a narrower opening, which can be difficult. So I'm just trying to separate this from the canal wall, but you may have seen already, this plug is surrounded by a thick layer of dead skin. It almost resembles a keratosis obturans, but this is not keratosis obturans. But with a keratosis obturans, one of the hallmarks of it is that the skin plug, it has a white or silvery matrix surrounding it, and that's a layer of freshly secreted skin that's in the process of shedding. So I'm being so cautious. I'm just seeing if I can glide the ear hook in and behind, but you can see there's no space there. But this is where the ear pick that I developed is really beneficial, because it's got a lower profile. I've used the pick a couple of times already. So with the pick, I am able to glide in. And although it doesn't remove the plug, I am separating it from the canal wall, and I am dissecting it through the middle. Now, some of it I do get out. You'll see a piece here, a chunk. But every time we go in and breaking up this plug, we're making it smaller, we're making it a bit easier to remove. And I'm smiling at that because it's still a challenge. So I'm just going to go back in with the suction. Now, because I managed to break away some of the wax from the center of this plug, sometimes if you go back in with the suction probe to the side of the canal wall and trying to drag it into that center, into that space that's being created, you can kind of bring the plug together and miniaturize it, if you like, squeeze it into a smaller ball, which then you can remove. But if you look in the distance, you can see that tail end of that plug when I'm trying to wriggle it. And I'm almost trying to guess myself what instrument I'm going to use. So here's the correct. I'm trying to glide across the bottom, and again, we're going to be so gentle. Now, fortunately, with the right correct, it has got a tapered tip. So the tail end, the furthest end of it, the distal end, it's thinner. So I'm exaggerating it a little bit, but you can see it tapers, which allows me to get in and behind the wax on the canal wall. And there's also a slight curvature to the correct, which mimics the curvature of the ear canal. And again, the reason for that is to minimize patient contact, so it glides through and it minimizes friction. So I did manage to get a little bit away there. So I've just gone back in with microsuction once more. So we are making headway. This plug is, we're getting deeper and deeper into the ear. So we are now working in the isthmus region. So this space I'm working in now is probably 1/2 centimetre to the eardrum. So we know the eardrum is in close proximity. Again, I'm just trying to, I can feel the plug is, where I'm going to get this out is from the posterior pocket. This is where it's trying to come away. I think I'm just going to go back in with some more drops. Oh no, not yet, but I will do, I'm pretty sure. Now there's loads of hairs there, and this patient last time did use cotton buds. They were quite open and honest, and I did obviously tell them to stay away from it. They assured me on this occasion they didn't. Now a potential reason why these hairs are matted, because the hair shouldn't be this deep in the ear. The hairs, as you can see, they should only be growing in the outer third of the ear canal, and the dermis, that's because the skin that lines the cartilage region contains the dermis, and that houses the hair follicles. So you will never really, you'll never see hair growing on the bony part of the ear canal. If there are hairs there, they're dead hairs that have fallen away from the cartilage region, and typically they've been pushed in. Alternatively, if people trim the hairs around their tragus and the entrance of the ear, some of these hairs can fly in. If you're one of those people, I would just recommend positioning some cotton wool, not in your ear, but just flatten it against the surface so you're closing the door to the ear canal, and then feel free to use the trimmer, and it just prevents the hairs from flying in. So that's where I used the forceps. It wasn't really effective. I managed to get the bottom jaw, the floor of the ear canal. Sorry, I've got a squeaky chair. And I did remove a little bit, but it just wasn't the right tool. But I tried everything else by this stage. I thought, well, why not give it a go? Now, this is starting to come away. So I feel I'm obliged to now to upload the right ear procedure tomorrow. It wasn't the best visual because that ear was a lot narrower than this ear, and there was quite a few hairs at the entrance. And what was shocking, that plug was quite big. If that plug was in this ear, I could imagine that, but for that size plug to be in the right ear was quite shocking. And I managed to remove that with the ear hook. It came out in one plug, but before I removed that plug, I removed quite a lot of more wax near the entrance. I'm kind of giggling and smiling because I should learn by now that nothing should surprise me when I'm removing earwax. There's always be something else that throws me or happens, or you see another funny foreign body in the ear, and you just wonder, how did that get there? So the world of ears never ceases to amaze. Now I've just put some more drops in. It is now starting to come away, and I know that as I'm looking at the timer and I'm like hitting 13 minutes, and I know the video stops at 14, so we're nearly there, guys. You can see on the right hand side of the plug, just to the right of the suction tip, you can the suction tip itself had imprinted itself on the wax, and that's because it's got this chewing gum consistency. It's embedding against this kind of sticky wax, and it's making some marks. And again, it's that back region. I need to bring it up and away. I know that's where it's trapped, and there we are. I managed to rotate it, pull it away. I'm going to bring it to the entrance now. So we're near the end. The light is at the end of the tunnel, or should I say at the eardrum. But still, it's getting trapped in the second isthmus. So we've got a second narrowing in the ear, and that's between the first and second bend, so in the first 1.5 centimetres of the ear canal. And there we go. Now the eardrum is quite red. There was a bit of stuff, skin there, the residue from that plug. You can see it's a bit vascularized and inflamed at the top. But so yeah, this is the plug that I removed from their right ear. So do stay tuned, and I hope you forgive me for putting that up as a thumbnail. But I just thought it would be a good introduction for tomorrow's video. Well, take care, guys. Keep well. Speak soon. Bye.